When a pediatric patient who was found down without a known traumatic mechanism of injury presents to your emergency room, there are no clear guidelines as to whether or not these kids should be placed in a cervical collar. Some clinicians will place them in a cervical collar just to be safe, but is this what's best for the kids? We know that C-collars don't come without risks, and the incidence of C-spine injury in this population is very low. I'm Alex Halpern, general surgery resident from George Washington University, working with Cincinnati Children's, and this is an article that you should know. Dr. Grant and her team from Penn State performed a 10-year retrospective chart review trying to answer this question. They looked at all 464 obtunded pediatric patients without a known traumatic mechanism of injury who presented to their pediatric ICU and whether or not they were placed in a cervical collar. They found that 8.4% of these kids were placed in C-collars, and the kids placed in C-collars received significantly more imaging. There was 0 C-spine injuries in this entire patient cohort. These new findings raise questions as to whether or not these obtunded pediatric patients without a known traumatic mechanism of injury should be placed in a C-collar. Let us know what you think in the comments below.